So this patient's coming in for removal of a rapidly growing lesion on his upper lip. This is consistent with what we call a pyogenic granuloma. These usually start because of either inflammation, infection, sometimes traumas, irritations. It's always hard to trace them back, but they can grow pretty quickly. The complication, this has no cancerous potential, it's nothing worrisome from that perspective. The problem is if we leave it, they can get secondarily infected, they can continue to grow, and it becomes more difficult to remove them. The difficulty here is this one's obviously on his upper lip. So we want to be very careful. This border here between his lip and the normal skin is called the vermilion border. That's what we want to be avoiding because that's what creates asymmetry. In the short term, he's going to lose some mass through here because we're going to have to do an elliptical incision. But a lot of that will fill back in. It's just this border that we have to be very careful of. So we still want to be doing an elliptical incision. It's hard. These tissues are very elastic, but they shift a lot, which makes this a little bit more challenging than, say, if we did it on just about anywhere else in his body. But we'll want to be taking out a little bit of an elliptical incision, taking this out, then suturing that closed, and then going from there. So this is so swollen because that's freezing in it. That doesn't hurt at all when I do that? No pain there?
No.
So this is no, you're good, you're good. This is our number 15 blade. And I talked about before the procedure, the problem with this will be the bleeding that happens downwards, obviously into his mouth, which is a complication. You're okay?
Mm-hmm. So what I'm trying to do here is extend the apex. Once I have that down, then I'll come back underneath it and then we'll excise that out. There we go. So like anywhere else, this is, I want to get down to just below the dermis. So the strong part of the actual lip is no longer being an issue for us. Mm-hmm.
So this is good. This is an awfully vascular spot, obviously. So now what we want to do, as opposed to where we'll cauterize this, I just want to be tamponading this with the actual incision, the actual stitch, sorry. So I'm just going to be using, I'm not going to be using that right.
No.
I'm just going to be putting stitches in and running that through to sort of seal this back together. So just put pressure on that. I think it's going to get things ready.
Absolutely.
So you can see there we haven't involved the vermilion border. It's below it, so I don't mind if my stitch is beyond it. But the incision, you can see there, is below the vermilion border all the way along. Just put pressure on that rather. So I want the ends of this to be small because it's going to interfere with his mouth otherwise. So here I'll put pressure at the distal end as much as I can until I get the other stitch in. Just pressure on the other end. Good. Good, touch short. You're okay?
Mm-hmm.
Yeah. Just put pressure on there. The other argument here as to whether we use dissolvable versus non-dissolvable stitch. It might seem like when you look at this to sort of say, well, you clearly want to use dissolvable stitch, but actually here, because I want to be taking these out, dissolvable stitch, if it's communicating with the surface, it takes forever to sort of dissolve completely. So because of that, I'll actually prefer to use non-dissolvable stitch. But then we're going to take that out relatively quickly. 5-6 days, something like that. Just put pressure on that for me. So you can see how now, even though the one side looked a little bit jagged, it's actually come together quite nicely. So we're going to put a bit of a dressing on that. So this is follow-up of the pyogenic granuloma removal. This is only 5 days later. You can see already how the volume of his lip almost already sort of replenished itself. So we'll be taking these stitches out today, but that's showing how remarkably that fills back in. So that should look relatively normal even in the course of the next couple of weeks. So this is now with the stitches completely out. You can see that that's going to heal nicely for him. Other than, a little bit of scabbing and inflammation, you wouldn't be able to tell a big lesion was taken out there. So that should heal beautifully.
आज हम आप लोगों को दिखाएंगे कि हम लोग क्या पी रहे हैं। ये सबसे पहले तो हम आपको पहले दिखाते हैं कि ये चीज़ क्या है। ये एक मग है जी, ठीक है। ये स्टील का मग है, गोल मग है ये, ठीक है। इसके अंदर सारा कुछ ही आ जाता है। ये बहुत ही कमाल का स्टील का मग है जी। ये नीचे से देखिए आपने स्टील के मग को, बहुत ही कमाल के है। इसके अंदर कोई भी चीज़ आप डालते हैं, हाफ़ के जी तक आप चीज़ें इसके अंदर डाल सकते हैं, ठीक है। अब मैं अगली वीडियो में आपको दिखाऊँगा इसके अंदर क्या है। ये देखिए कितना गोल सा स्मूथ सा मग है, बहुत पुराना मग है हमारा ये, ठीक है। इसको हम बहुत ज़्यादा इसके अंदर चीज़ें डाल के इंजॉय करते हैं। और ये देखो अभी इसके ऊपर वो ना बर्फ़ सी लगी हुई है, मैं आपको दिखाता हूँ। ये देखें मैं इसको अब नीचे रख के दिखाता हूँ। इसके अंदर बर्फ़ लगी हुई है, ये देखें, ठीक है। नज़र आ रहा है ना, ठंडा मग है ये हमारा अभी तक। तो ये बहुत ही कमाल की चीज़ है और बहुत ही कमाल का मग है। इसके अंदर हम कुछ पीते हैं, आपको दिखाते हैं हम क्या पी रहे हैं, ठीक है। इस तरह का मग आप लोग भी इस्तेमाल करें, बहुत ही कंफर्टेबल मग है ये। देखें कैसी लुक आ रही है मग के अंदर।